Hello, welcome to any community. In this particular video, we are going to discuss Mutravaha Srotodushti. Its context, its Srotomula and Srotodushti Karana, Srotodushti Lakshana and Srotovitha Lakshana are going to get discussed in this particular video. Mutravaha Srotas is a Srotas which is actually responsible for the transport of Mutra from the body to the exterior. The main function of Mutra is Kleda Vahana. That means the transport of the Kledatva from the body to the exterior. As per Ayurveda, it has been mentioned that Mutravahanam Srotasam Bastir Moolam Vankshana Ucha. The Srotomula for Mutravaha Srotas are Basti, that is urinary bladder, and Vankshana, that is the groin region. So, as the pathogen entry is concerned, that can happen either through Basti or through the Vankshana region. In that way, there may be a possibility of either the Basti affliction or Vankshana affliction due course of time. There may be a possibility of affliction of both of these Srotomula may take place, depending upon the source of the entry of the pathogen. Either it is through the urethra or through the kidney, like that, or number of pathogens entering into the human body and virulence of the pathogens entering into the human body. So that are going to decide the organ afflicted in the Mutravaha Srotas. As far as Mutravaha Srotodushti Nidana are concerned, Charaka says, Mutritodak Bhakshastri Sevanad Mutra Nigraha Mutravahini Dushyanti Kshinasya Abhikshatasya cha. If you rearrange this, Mutravahini bracket Srotamsi Mutritasya Udaka Bhakshana Udaka Sevana Mutritasya Bhaksha Sevana Mutritasya Sri Sevanat Mutra Nigraha Kshinasya cha Abhikshatasya cha Dushyanti. So that means the Mutravaha Srotas are going to get afflicted if the person is indulging in Udaka Sevana, when he is having the urge of micturition, Mutritasya Udaka Sevana, Mutritasya Vaksha Sevana, where the person is going to consume the food substances while having the urge of micturition. Mutritasya Sri Sevana, where the person is indulging in the sexual activity during the urge of micturition. That will lead to Mutravaha Srotodushti. Further, Mutra Nigraha, suppression of the urge of micturition. Dhatu Kshaya, where there is a state of depletion of the body tissues that are being present. Abhikshatasya, physical trauma to the body. All these causative factors are responsible for the affliction of a Mutravaha Srotodushti. This is what we can say, Mutritasya Udaka Sevana. He is having the urge of micturition, but he is going to consume the still large amount of the fluid. Person is having the urge of micturition, he is going to consume the food. Person is having the urge of micturition and he is indulging in the sexual activity. All these are responsible for the Mutravaha Srotodushti as such. Whenever if you think about the Mutritasya, in the sense the person will be having the urge of micturition and he is neglecting this particular natural cause, this will be responsible for the reverse movement of the fluid portions, that is urine. So this will be leading to the distension of urinary bladder. Thereby there may be a possibility of distension of the ureter. There may be a possibility of distension of the even in the kidneys also. What we can say, hydroureter and hydronephrosis may be the possibility. So when the person is having the urge of micturition, naturally, so this will be responsible for the pressure effect to happen. If the person is consuming the fluid portion, that is going to get absorbed through the stomach. If the person is going to take the food substances, that is going to take absorbed in the small intestine as such. So in this way, so this will be adding the bulk to the intravascular compartment later, which in turn gives the even much more burden towards the functioning of the kidney itself. In that way, Mutravaha Srotas may be afflicted because of this. When you think about the, what do you say, that the Dhatukshaya, naturally, so this will be resulting in the reduced, what do you say, that the blood supply to the kidneys itself. When there is reduced blood supply to the kidneys, naturally reduced urine formation will be the outcome. Thereby the person may have the Mutravaha Srotodushti there. Abhikshatasya, physical trauma to the body, any part of the body. So which resulting in the gradual or the loss of the blood or sudden loss of large amount of the blood, which leads to reduced blood supply to the kidney. Thereby the person may have the Mutravaha Srotas affliction. One thing that we said, Mutra Nigraha, suppression of the urges also, which in turn results in the similar fashion. That is what we have discussed earlier. Retention of urine, that is the swelling in the suprapubic region, hydroureter and hydronephrosis may be the outcome. As far as Mutravaha Srotodushti Lakshana are concerned, what are the Lakshana or the clinical features are observed when the person is having the affliction of Mutravaha Srotodushti? It is been mentioned that Pradushtanam tu phalvesham vidam vishesha vijnanam bhavati tadyatha atisrashtam atibaddham prakupitam alpalmam abhikshnam va bahalam sashulam mutrayantam drishtva mutravahanyasya srotamse pradushtani iti vidyat. Atisrashtam atibaddham prakupitam alpalpam abhikshnam va bahalam sashulam mutrayantam drishtva. When you think about atisrishta mutra, the person will be having excessive frequency of micturition. Atibaddha mutra, so that is the reduced amount of urine form, but the person may have oliguria or anuria. Prakupita mutra, so that is indicating the dosha dominance. For example, if the person is having the pitta dominance, the discoloration of the urine will be yellowish or reddish. If the person is having the kapha dosha dominance, the color of the urine may be whitish. So in this way, prakupita mutra may be present. Abhikshina mutra, so that is the abhikshina mutra. So that is what we can say urinary incontinence. The person will be passing the urine. He is not having the control over that. Bahala mutra pravritti. The person will be passing the large amount of urine at a particular time. Sashura mutra pravritti. The person will be having the pain during the micturition. As far as Mutravaha Srota Vidhalakshanas are concerned, the person will be having Anadha Bastita. So that is distension of the lower abdomen or urinary bladder may take place. Mutra Nirodha, that is retention of urine may be taking place. Stabdha Medhrata or priapism may be observed, or which may be considered as dysfunction of male genital organ. Swelling in the suprapubic region. It also happened, the 50-year-old male came to one OPD with the history of the absence of micturition from the morning 4 a.m. He visited the hospital at around 11 a.m. At that particular time, we saw he is walking with the forward bending posture. On examination, we made the patient to go towards the testing table. He was not in a position to sleep itself, and he was having profuse sweating over the forehead, and he was forward bending. On looking into the lower abdomen, it was being identified that he had the large suprapubic swelling. Based on the age factor, based on the other clinical features as such, it was being diagnosed that he was having the acute retention of urine. Probably maybe the cause of, we say that the prostatomegaly. We sent to the nurse's counter for the immediate measure. So that is catheterization. After catheterization, nearly around 800 ml of urine that was passed at that particular time period. Normally, 200 to 250 ml of urine will be passed when the person is having the urge of maturation. Because of this retention for long period, 800 ml, almost 3 times the urine formation, urine was passed at that particular time. So that was being associated with swelling in suprapubic region. Mutra Nirodha, because of the obstruction in the either in the urethra or in the urinary bladder or in the both the ureters as such, there may be a possibility of a what do you say that the retention of urine may be take place. Sabdhametrata, restricted movement of the male genital organ may also take place when the person is having the injury to the Mutravaha Srotas. Take home messages from today's discussion are Mutravaha Srotas is mainly concerned with the Kleda Vahana, that is, the movement of the Kleda or moist portion from the body. Basti and Vankshana are considered to be afflicted, either singly or both may be afflicted in case of Mutravaha Srotodushti. As far as Nidana of Mutravaha Srotodushti are concerned, मूत्रोदक भक्षस्त्री सेवनात् मूत्र निग्रह मूत्रवाहिनी दुष्यन्ति क्षीणस्य अभिक्षतस्य च. As far as Mutravaha Srotodushti लक्षणाs are concerned, अतिसृष्टमदिबद्धं प्रकुपितमल्पाल्पमभीक्ष्णं वा बहलं सशूलं मूत्रयन्तं दृष्ट्वा मूत्रवाहन्यस्य स्रोतांसि प्रदुष्टानि इति विद्यात्. As far as Mutravaha Sroto viddha lakshanas are concerned, तत्र विद्धस्य आनद्दवस्थिता मूत्र निरोधः स्तब्धमेढ्रता च. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. What is the one video that you'd like to hear the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of 2 Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.